of the 5 domains of this exam that you are assessed on. Okay, 14 stations, 5 domains. And people, they get really confused about some aspects of the domains. I hope everyone is now clear about what do we mean when we are saying patient safety. Somebody needs to come forward and give me examples of patient safety in anything that comes to your mind. Please tell me, what do you think is patient safety? So what's the plan agenda of today? I will touch upon the basics to see how well you understand the basics. Okay, then I'll move on to say what I think are the most common, like what are the reasons of failure? Why is this exam such a huge monster for for some? Yeah, and then we'll talk about probably we'll talk about a couple of situations which I would want you guys to, like I'll pose questions and I'll invite you guys to, there will be like mini stations, like not full station. I'll give you a certain angle, a certain perspective and say, okay, talk to me about this, okay? So we'll deal with these things. Somebody was saying something. Who was that? Was it Manika?
Ma'am, inquiring about the patient's name and age, checking her name and age, it's the patient safety, ma'am. Then the
good.
And the allergies, asking about allergies.
Good.
Blood transfusion and whether she's against transfusion, whether she's a Jehovah's Witness. And
okay, good. But this always remember that these are not universal. Like you don't have to ask them in each and every station. This is a big misconcept. I tried to clear it to people who were appearing in the last exam. That please, you don't waste your time asking these things in all the stations. Okay, that's a big misconception. Actually, I noticed that people have started. The news goes, it spreads when somebody says something. So when I started observing people from overseas in a few months ago, I saw that everyone was doing it. But when we spread the word out that no, this is not for everyone, not all the stations, I'm happy that people in even other groups have picked this up, and they are now, they've kind of modified what they're teaching, which is in a way is good because it's helpful for the candidates. Okay, so yes, you are right, but only where it's applicable. Any other example of patient safety?
An example is telling patients the flag signs and he needs to come back to the hospital. Red flag signs. Red flag signs.
Good. Yes, yeah, absolutely. Good. Anything else?
The patient needing admission should be admitted and not told to come back, and things like that.
Good. So actually, if you, go on.
For example, the choice of place of delivery, encouraging the patient to have hospital delivery as against home delivery, if she's high risk.
Good.
Ruling out domestic violence.
But absolutely, yeah, excellent. Yeah, domestic violence, very important. Yeah.
And inquiry about childhood sexual abuse in the endometriosis.
Where applicable, applicable.
Wherever, yes, ma'am.
Yes, wherever applicable. Absolutely. If you missed, somebody was giving you some, nudges, some cues, and you missed, then that's a patient safety issue. Yeah. So if I generalize it, if I make it more like when I started, looking at the domains, this was a question: what on earth is that? Because for me, everything is patient safety. Okay, everything that we do in medicine is patient safety. Everything. We're not allowed to do anything that's that is not really safe for the patient. We're not allowed to miss anything. is examination of the patient not a patient safety issue? It is. If she requires examination and you missed it, that's a patient safety issue. Is information gathering not a patient safety issue? It is. If you missed gathering important information, that's a patient safety issue. Yeah. So patient safety issue is very, very widespread. And first I was like a bit, surprised at why is it a separate domain and what's coming underneath under it. But then after going around and seeing everything and looking at things that this is precisely patient safety, this is precisely, I came back to square one that no, actually everything is patient safety. What happens is that you need to remember that anything important that you miss, anything important that you miss will become a patient safety. Anything important that can end up compromising the care of the patient, okay, or even worse, if it puts the life of the patient at risk or health of the patient at risk, everything becomes patient safety issue. Yeah.
Prescription of medications, ma'am, in providing aspirin in a condition to prevent preeclampsia.
Absolutely.
And
absolutely. So you see, it goes from information gathering to examination to management, and management would include all the management options that you're giving, including the prescription, including whenever you're talking about any medicine, you're talking about the suitability of the medication, the allergies, and any other contraindications. You're not going or missing any important medication. Yeah. So if she needs low molecular weight heparin, you don't give it to her. Is that again is a patient safety issue? Yeah. So actually patient safety issue is everything. Whatever you missed, it was important for the patient and you missed it. You forgot to write the letter to the GP. That's a patient safety issue because, patient may end up being mistreated by the GP. GP is not aware that this has happened to this patient. I should now not give her this medication, or I should continue to monitor her for high blood pressure or something like that. So that can become a patient. So actually this is quite a misconception that there are certain number of things, maybe 20, maybe 100, maybe 120 that come under patient safety issue. It's a big misconception. Everything is patient safety issue. Okay. Everything, every omission and error. Yes, it can be a smaller or a bigger issue. Okay. Patient safety issues can be mild, that have some effect. They can be grave, that can have really major effects. Okay. So when you are in an exam, try to be very comprehensive and holistic in your approach. Okay. Think that you're not going to miss important things. And I don't mean that going to nitty-gritty of everything. I mean that you continue to make sure that you are not missing out on any big issues, especially. Okay. So that will be patient safety. Avoiding
the pregnancy contraindicated medications like the ACE inhibitors and angiotensin receptor blockers, statins, they have to be stopped in hypertensive patients, and baby-friendly medications while breastfeeding.
In preconception counseling, what would be the major patient safety issues? Patient comes, she's from any medical condition, and she's there for preconception counseling. What do you think are the major?
Her general health to be optimized, ma'am. The particular medical condition has to be optimized. The medications she's taking, like is immunosuppressants, they should be, whether they are safe, like methotrexate or phenitel. This has to be stopped 3 months before conception.
Yeah.
Multidisciplinary care too. Multidisciplinary care.
And folic acid for the certain patients, they require 5 milligram folic acid. Yes, ma'am.
If she is for preconception counseling, then some patients will require high dose, but everyone will require folic acid. So if just folic acid is very, very important in preconception counseling. Folic acid, you will ask her to continue her contraception until she is,
till her condition becomes optimized.
If you forget that, you almost
Yes,
fail the station. But I won't say
Yes,
you
ma'am.
don't actually fail the station on one or two things. That should be your reassurance for all of you. You don't fail station for just one or two things, but it's a compilation of errors that makes you fail the stations. Okay. Okay, so we seem to be good and clear about what can be patient safety issues. So patient safety issues are not really, they're like an umbrella. They cover everything. Patient safety is like an umbrella, okay? It's not like 1, 2, 3, 4 things only, okay, or 100 things only. It's like, it covers everything, okay? Got it?
Yes.
Now, other aspects are relatively very easy. In 5 domains, the most confusing thing that people find is always, whenever I see students, candidates questions, they're always around patient safety. Information gathering, you all know. Applied knowledge, you all know. This communication with patients and communication with colleagues, you don't have any confusion about that. Does anybody have any confusion about these ones? Speak now. Any confusion about other 4 domains, please?
Communication with colleagues.
Communication with?
Colleagues.
Communication with colleagues, okay. So I guess your concern here is coming from the fact that you're thinking what can be the communication with colleagues in just a station where there's a patient sitting in front of me only. Is that correct?
Yes.
So Manikam, we have spoken a lot about communication with colleagues, and I've got a very big video on YouTube as well on that, and you watched that, I believe.
Yes,
would you indicate, you have, I know. So would you want to highlight what are the communication with colleague elements here, so we can quickly
whenever a high risk pregnancy is coming, we have to treat the patient under consultant-led unit, under care of a consultant, specialist, midwife.
So MDT care, we need to quickly do examples of with colleagues, MDT care. And so Hafsa, what I want you to imagine is that if there is a station, and the most basic things that can score you marks in that domain are, first of all, just talk about, I'll write back to your GP, okay? That is that you don't want to miss, because even if there's nothing else in that station and you said that sentence, that counts as your communication with your colleague, and that gives you that score, okay? Now you know that you need you need to avoid 0 in every domain, but you preferably want a 2, okay, not a 1. So if there were more things required and you only mention GP, you'll at least not get a 0, you'll get a 1. Now you add on more things, like you say, I'll involve my colleagues and I'll speak to my consultant. Say this in every station. Don't say I'll book you an appointment with the consultant, please. Don't say that in every station. That's a big misconception. You don't say that, because that's going to be a real headache. If all the registrars, after seeing their patients, they started booking the same patient with the consultant is going to be really going mad, okay? You are seeing the patient on behalf of the consultant. You don't say at the end of every consultation that I'll book you an appointment with my consultant. Because such a, that just shows that you don't know what happens in UK. And in this exam, we need to impress the examiners that we know what happens in UK, okay? So we don't need to say that I'll book you an appointment with a consultant. But yes, what I do is, right in the beginning, when I'm talking about, when I'm introducing myself, and when I'm giving the agenda to the patient, I immediately say that at the end of the consultation, I'll write back to the GP. And if there's anything that requires my consultant's advice, I'll seek his advice as well for you. Okay. So that means that you have included your consultant as well. That is another communication with colleagues. Then whatever referrals are done, if some referral is required, you want to offer the patient, I can refer you to my colleague who is expert in, maybe physiotherapy, maybe incontinence nurse, or whatever. So you will ask them that would they like to be referred to them, and that will be your communication with colleagues, because you mentioned that you need help from your colleagues. Okay. MDT care for all the patients who who require MDT. Most of the patients require MDT cares. Okay. So there is a lot there. Yeah. So Hafsa, you see in each station you can bring GP, consultant, MDT care. And these are the easiest marks. Okay, these are the easy communication with patient. I've seen people ruin it. Okay, that's actually more difficult for some people, much more difficult. But communication with colleagues is just these 3 sentences or 3 words, and just to do. When you have nothing else, you have these 3. GP. You don't say that for each patient, you don't say that I need input from my consultant, but you say that if required, and if required makes it universal, isn't it? You say it right in the beginning to the patient. If required, I'll seek input from my consultant as well. Good, well done. So you've got one communication with colleague there as well. And then MDT care, most of the patients will benefit from MDT care. So whatever kind of referrals and whatever, so we've got a lovely team here very competent team here. We've got experts here saying things like that. That is communication with colleague. Why is it communication with colleague? Because you are planning to communicate with your colleagues. You're planning to involve them. You know the significance of your colleagues. You're not thinking that I'm just one-man army and I can deal with it. I don't need anyone else. That goes against the soul and spirit of how we work in NHS. Yeah. See, so communication with colleagues is easiest marks, easiest scores that you can have you can get in the exam. Okay. So anybody was saying anything else there? Okay. You see, Hafsa, is it clear now?
Yes, thank you.
Ma'am, if there is an emergency like that, anything happens, we have to call for help.
Yeah, absolutely. In emergency cases. So this is what I just mentioned is it applies universally to all stations. Yeah. So Manika, you pointed out exactly one of the very, very important things, that call for help is so crucial. It's so crucial for all the emergency cases. Okay. So whether it's in labor ward or whether it's a scenario on its own, call for help is extremely important. It's not only communication with colleagues, it comes in patient safety as well. Okay. Yeah.
Yes, ma'am.
And even if you didn't know call for help, they'll probably think you don't have applied knowledge as well. Yeah. One thing spans so many domains. Yeah. Okay. So some of your things, they will get you, some of your mistakes can get you a 1 rather than a 2 if you did those big mistakes, because in more than one domain, they'll deduct from there, because they'll think that this is a grave mistake, and because call for help is important for communication, is important for applied knowledge, it's important for patient safety. You can get 1 in each of them rather than a 2. Okay. Their purpose is to they aspire to give you a 2. They don't aspire to give you a 0. Now go with a positive attitude in your mind that they don't aspire to give you a 0. Okay, they aspire to give you a 2, unless you do something wrong, unless you take it away. Okay, only you can take away your score. Okay,